Welcome to the Proctology and Laparoscopic Surgery podcast series. This is Dr. Ranjan Tripathy, Proctologist and Laparoscopic Surgeon with you. In this podcast series, we usually bring some of the very important topics regarding surgeries, spread awareness, and help patients get over the fear of surgeries. Today's talk will be very important for hernia patients, as we will discuss how patients can take care of themselves for faster recovery after hernia surgery. I will share some do's and don'ts after hernia surgery so that patients don't face much problem and recover as fast as possible. So let's get into it. Many patients are likely to suffer pains for a few days after undergoing a hernia surgery. It's also common to feel tired, nauseated, and as if one has a flu or a low fever. This happens in about 20 to 25% of patients after hernia surgery. But after 5 days or so, patients start feeling better. For several weeks, few patients may feel aches or stretch feelings in the groin area, especially while moving. It's normal for men to have small bruises on the scrotum and along the penis after the surgery, usually for large groin hernias. Depending on what is the type of surgery, the recovery time after hernia surgery would also vary. Meaning, recovery time for the conventional open procedures is comparatively more than laparoscopic surgeries, especially if patients are operated for bilateral hernias. Now, how to care oneself at home after hernia surgery? Patients usually obtain a general idea about the recovery and other related things with this article. However, each individual would recover after the surgery at a different pace. Besides, as mentioned before, recovery also depends upon the type of surgery patient has undergone. Now I am going to tell some common recommendations what you should and should not do after hernia surgery in order to prevent infection, avoid weight gain and cuffing, and to enhance healing. Usually post-surgery, at the time of discharge from the hospital, the common queries which a patient puts towards a doctor related to restrictions in the diet, activities, having bath, etc. etc. So in general, one should rest whenever one feels tired in the post-op period. Regarding having a shower, patients can have shower 24 to 48 hours after the surgery, depending upon the type of the hernia repair they have undergone, and if the treating doctors so allows for it. After surgery, it is usually suggested not to move swiftly or lift anything heavy until you feel completely fine. It would be better if you avoid lifting weights or engaging in sports or strenuous exercises for at least 4 to 6 weeks post-surgery. Your engagement in the activities again largely depends on the type of procedures you had for hernia repair. But make sure to get the doctor's opinion regarding resuming exercise routines or sports regimes, because every patient profile is different and so is the type of procedure done on him or her. Walking is usually encouraged from day 1 after surgery. It's a healthy decision as it increases blood circulation, which in turn speeds healing without straining the abdomen. Usually patients are allowed to return to work after 1 week, and by 3 weeks they are usually allowed to do light to moderate physical activities. Another most important queries which patients have is regarding the diet to follow after hernia surgeries. If you ask me, usually there is no specific diet restrictions after day 2 or 3 after a hernia surgery. But if the stomach seems upset or patients have reaction to the oral medications which they consume in the post-operative period, they should try going for bland, low-fat food items like plain rice, toast, broiled chicken or yogurt. In case the bowel movements are not regular after surgery, then they are encouraged to have plenty of water, high fiber diet, and many times doctors recommend having stool softeners or laxatives, especially in patients with large hernias and old age patients. Regarding medicines in the post-operative period, usually after clean hernia surgeries, anti-inflammatory and analgesic medications are recommended by the doctor in the first week after surgery. There will be a dressing over the incision area to aid in the healing and protection of the wound. Usually the doctor tells the patient how to take care of the dressing, and most of the time wound care is carried out by the doctor or one of his assistants. If there is a skin adhesive or a liquid stitch on the incision, usually patients should leave it there until it falls off. Sometimes there may be small strips of tape on the cut which needs to be left on for a week or until it falls off. Any handling of the wound site is usually discouraged by most of the surgeons. So what are the warning signs we should be aware of after a hernia surgery? In the post-operative period, if patient notices any of the following, they should usually call the doctor or seek immediate medical care. The conditions being sustenance of pain even after taking medications. If the surgical incision becomes open or stitches start getting loose. If there is bright red blood-soaked discharge from the bandage. If the stomach seems sick and one is not able to drink or eat food. If patient finds signs of a blood clot in the leg, also known as deep vein thrombosis, it may either result in pain in their calf, back of the thigh, knee or groin, or redness and swelling in the leg or groin. This is an emergency condition which needs to be immediately attended. More commonly, if the patient is unable to pass stools or gas, they need to see the doctor urgently. If there are any signs of infection in the wound, like excruciating pain, swelling, warmth or redness, or red streaks leading from the incision area, or pus draining from the incision with fever, then it needs immediate attention from the patient and the doctor's side. So that's all about self-care after hernia surgery. If you are able to follow all, you will surely see a huge improvement and faster recovery from the surgery. It was a very long podcast. Thank you all for sticking till the end. Hope it was helpful. I'll bring another important episode like this. For now, thanks for listening to me. This is Dr. Manas Tripathy signing off.